how a person with dementia will respond to death will depend on the stage of their dementia and their level of understanding. So what we really want to do is we want to make sure that we tell the person, I think they have the right to know that the person has died. And we tell it in a way where, we make sure that, we're doing it in a place where it's, it's quiet and private and there's not lots of distraction. We share it in a way that they can understand. So we use language that they can understand, and we give them time to process that information. And then we can make a call on whether or not they actually understand what's happened. So for some people, they may understand, and for others, they may not, if their dementia is at a more advanced stage. But we also need to be mindful then is that the person will obviously go through the process of grieving if they do understand. But depending again on the stage of dementia, they might forget quite quickly that the person has died. And we may want to tell them again. But we'll also need to make a call on that, because if the person becomes very distressed every time we tell them the person has died, then we do not want to be causing that person ongoing distress. So we then need to think about, well, if someone's asking for their mother or their father or their husband or wife or someone that they love that has died, is it, well, why are they asking for them? They're asking for them because they're thinking about them and they're missing them. So whenever we think about somebody or we're missing them, what would help? It would help to talk about them. Yeah. So we could say, if they're asking for their mum or their wife or their husband, well, so tell me about your mum. What kind of a lady was she? Or, so what we're doing is we're engaging with them and thinking about that person, and we're meeting the need, because the need is, I miss this person and I want to be thinking about them. So we can meet that need without necessarily re-traumatizing them, but reminding them about, oh, but actually your mum has died, or your wife's died, or your husband's died. So it will depend on the stage of the person's dementia, what their understanding is. And then or for someone who wants to remember, we could have a consistent story for them, and it needs that consistency. So if something's not quite right and the person's not there, we can say, well, yeah, do you remember that your wife hadn't been well, she had a period of illness and she was in hospital, but she died very peacefully in hospital, and do you remember you were able to go to her funeral and plan her funeral, and you could show some pictures, and that might give the person some comfort. So we're going to play around with the response depending what the person's understanding is, and find a consistent response that helps that person. And if we find that reminding them doesn't help, then we'll actually meet the need to engage and think about that person in the moment. Yeah. Other thing also that's really important is the consistency, because sometimes someone will say, look for their wife, and they'll say, oh, she's at the shop, or, she's here. So what you'll have is someone whose wife has died or husband has died, and they're constantly being told different things about where they are. Now, even if the person doesn't always remember all of that, you're just adding to that confusion. So you really need to have a consistent response, either to meet the need of thinking about them, or to share the experience, rather than telling different things, just because you're buying yourself some time until they ask again, but it isn't actually helpful to the person with dementia.